Melinda, thank you. It's been several weeks since we adjusted our clocks for daylight savings, so we should be adjusted to the new time by now, right? Well, some people aren't, and if you are someone that has trouble with excessive daytime sleepiness or have problems getting sleep, then wake up and pay attention. Dr. Fred Nagel with Baptist Health Family Clinic in Maumelle has healthy sleep advice for us this morning. Welcome again to the show. This really is a problem that you hear so often from people. I just can't sleep, or I go to sleep and then I wake up.
That's right. And sleep, when you think about it, it's one of the most basic fundamental needs we have next to eating and breathing. But yet, a lot of us have trouble finding that 7 to 8 hours a night that the average adult needs to go to sleep. We suffer from that occasional insomnia where we just roll around in bed, can't go to sleep, or wake up prematurely. But the important fact is, if insomnia becomes chronic, it can adversely impact your health.
Sleep is important. We need this.
That's right, and cause chronic medical problems associated with obesity, diabetes, hypertension, heart disease, depression. Can suppress your immune system and literally take years off your life.
So, causes of insomnia.
Well, there are many, and we can't cover them all, but it could be as simple as having bad sleep habits, which we've developed over time. A big one is stress and worry. You take it to bed and just can't shut that mind off. And some of them, again, can be related to chronic medical problems like heart disease, lung disease, sleep apnea, restless leg syndrome, and depression.
What are some of the ways that we can improve our sleep? Because there are things that we could do better to make the sleep better as well.
Yeah, I made a little list here, and that I hope we can show on our screen, but some things that we can do to improve our sleep is to have that bedtime routine that you need. You know, go to bed about the same time each night, wake up about the same time, set that internal clock. We respond to repetition. And there are many other things that we can do. Don't consume alcohol or anything stimulating at night, including medications.
Some people would say, I think alcohol helps me go to sleep better.
Well, maybe a little sip of wine, but otherwise alcohol is not. It shouldn't be used in that regard, and nor should you exercise right before you go to bed. Leave that stress at the bedroom door. You know, don't take it to the room
hard.
with you. And if you have to, write it down. Get rid of those worries and deal with them the next day. Other things you can do or just be consistent with that sleep pattern.
Gotcha. Okay. And medications, we hear commercials on TV for prescription medications and over-the-counter medications to help people rest. Are they good, and when should you turn to those?
Well, I brought some medications to demonstrate here. A couple of over-the-counter ones that are commonly used, melatonin and Tylenol #3, and then some prescription ones that are popular, named Lunesta and Ambien. Now, medications certainly have their role, but unfortunately people use medications as their first and only solution a lot of times for their sleep, when in fact they should only be used for short intervals. Because actually they can be harmful in long-term use, particularly in the elderly.
So be selective and talk to your doctor. There is a time when you really need to go talk to your doctor about this.
Well, when that sleep begins to interfere with your daytime function, when you're fatigued all the time, falling asleep while driving, particularly if you're snoring loudly at night or stop breathing during the night, you may have that condition called sleep apnea, which can be serious.
And a doctor could be helpful in that situation. We don't have problems sleeping because we're always tired, because we don't get enough sleep at night, which is also important.
We all feel better after a good night's sleep.
There you go. Dr. Fred Nagel, thanks so much. For more information, you can call the Baptist Health Line at 1-888-BAPTIST.